Hi, I'm Brittany Montez, and this is the Orlando Health News Review for July 14th. This week we talked to Mildred Beam, Senior Vice President and Chief Legal Strategist, to find out more about Orlando Health's Diversity, Equity, and Inclusion Committee.
About a year ago, David Strong had the idea of establishing Orlando Health's Diversity, Equity, and Inclusion Committee. He reached out to me to chair that committee, and at the time that he was looking at that opportunity, there was a lot of racial unrest occurring in the United States, and George Floyd had just died. So we wanted to look at our system to see if there were opportunities for more inclusion as it related to different ethnicities. What we noticed is Orlando Health is doing very well from an inclusion standpoint in comparison to other hospitals and health systems as it related to our ethnic composition for our team members. When we looked at the same thing for leadership, our physicians, our residents, and our nurses, we saw that we had opportunities. This committee identified goals to make recommendations related to increasing the diversity of our leadership team, our physician and resident component, and our nurses. We also looked at readmissions because that is a system goal, and we wanted to determine whether there were any healthcare disparities being experienced by minorities as it relates to readmissions from non-minorities, and we did see that that was the case. And so we've worked with our readmissions team on efforts to reduce those healthcare disparities and look at social determinants of health. We want to be a best place to work, and we want to be a place where our team member population feels that we're representative of the community that we serve. If we can even that out, we may not completely match it in the end, but we'll be a more diverse workplace, and therefore the viewpoints and sensitivities and issues that relate to certain categories of ethnicities, our organization will be more mindful of, and we'll be able to respond to team members and patients, of course, based on those differences.
And in honor of the one-year anniversary this month of Orlando Health St. Cloud Hospital joining Orlando Health, they celebrated with team member appreciation events that included mocktails, hors d'oeuvres, balloons, photo booths, and a fun time. Congratulations to the team on providing 1 year of care with Orlando Health.
And most importantly, I want to thank the team members. Again, change and newness is exciting but scary at the same time. And when I started looking at not just the things that have happened, right, the transition, but the results that we're starting to see out of St. Cloud Hospital, there's a lot to look forward to, a lot to be proud of, and I'm just thrilled and excited to see what this organization is going to be able to accomplish for this community for years to come.
Happy birthday, St. Cloud!
And if you're one of the 5,000 team members randomly selected to participate in a Great Place to Work survey, you should have received an email invitation on July 12th from Great Place to Work. Check your inbox and please complete the survey to share your feedback, which could qualify us for the prestigious Fortune 100 Best Companies to Work For list. The survey closes on July 26th. See Swift for more details. And for the past few months, you may have noticed some familiar faces on Swift. The Nurses Growing Together testimonial campaign featured stories from many inspiring nurses from across our organization. These valued team members shared their most memorable patient experience, why they're proud to work for Orlando Health, and how the organization has helped them develop both professionally and personally. The testimonials were a hit with more than 400 likes and 12,400 views. If you haven't had the chance to check out these stories, be sure to visit Swift to view before the campaign retires on July 21st. Well, that's it for today's edition of the Orlando Health News Review. See you next week.